Welcome to the Women's Show, and we are going to be speaking about the mental health. Recently, Uganda commemorated with the rest of the World Mental Health Day, and Uganda is also currently ranked among the top 6 countries in Africa that are having populations with mental health illnesses. Join me with amazing ladies on my panel on how best we can navigate this issue and on how best we can create safe spaces for everyone that is having a mental health illness. Thank you and you're welcome.
Thank you.
Thank you, Helena.
Yes. You can introduce yourselves and where you are from.
Thank you. Thank you so much, Helena. And thank you so much to Civic Space TV for providing for us this space. You have always opened up your space to us whenever we ask. So we want to say thank you very much to Civic Space. My name's Grace Obalimu. I think I've become a regular for this women's space, and I really appreciate that. I'm a clinical psychologist by training, and I work with TPO Uganda as their mental health and psychosocial support advisor. TPO is an NGO that implements community-based mental health across this country. I also support at the national level as the national coordinator for the Uganda National Mental Health and Psychosocial Support Working Group. I'm glad to be here.
Thank you.
Thank you and hello, our viewers. My name is Janet Katalama Katana. I am also a regular visitor on the Women's Show, and thank you so much, Civic Space, for opening up this space for us, first as women, but as well as mental health practitioners or people who are interested in mental health in Uganda. I'm the executive director of Safe Places Uganda, which is a private mental health hospital with 2 locations, one in Chambogo and another in Bujuko, where we hope that we can avail or increase access to mental health care for persons in Uganda that need that service. We offer all both outpatient and inpatient care, whereby outpatient, a person can come, get their care, then go back home, and inpatient is in case of the illness determines that you need to be admitted, then we can also do admission at our second place in Bujuko. And I'm glad to be hosted on this show and look forward to the deliberations. Thank you very much.
Thank you. And our topic today is mental health and the rights of persons with mental illness. And I wanted to ask all the panelists today that why is it all of a sudden that mental health is a topic that the community, the governments, and the practitioners are supposed to speak about? Start with you.
Thank you. Thank you so much, Helena. I like the way you put the question. Why is it all of a sudden that mental health has become of interest of everybody, from how you've put everybody, the government, the community, and stakeholders? I want to start by saying that mental health has been there with us. Mental health is actually me and you. If I can basically first, before I go to answer why now is the talk, I want to give a definition of what mental health is. You know, by WHO standard and WHO definition, mental health is a state where a human being understands their weaknesses and their potentials. They are able to cope with the daily stress that they receive, the daily stresses like death of a loved one, work overload, rent. Those are daily stresses that human beings face. You're able to cope with it. And as you cope, you productively contributing to your life as a person, the life of the people around you, and even your community.
Yes.
Now, that is mental health, normal functioning of a human being, coping with challenges, knowing what you can do and what you cannot do. And of late, why has it become very common discussions about mental health? If you look at the definition, it's purely the functionality of a human being. Without it, you can't function. Now, when your mental health is not functioning, that's when now we bring in the aspect of mental illness, the disease now.
Yes.
So, thanks to COVID, I keep telling people that as a mental health practitioner and an advocate and a lobbyist for mental health service delivery and system strengthening, I am so grateful that this world got struck by COVID. When COVID came, there was a lot of strategies that were laid across to mitigate and manage the spread, starting from, they first started by saying social distancing, use sanitizer, wear a mask, lockdown for isolation, and then isolated treatment of persons that have tested positive with COVID. All those strategies gave a ground for the issues of mental health to be fronted. After some time, the world realized that human beings are social beings.
Yeah.
That's what makes us different from animals. We are social beings. We interact with each other, with ourselves. So they realized that it's not, when you social distance, the recovery is not so much. So they started bringing into physical distancing. As COVID was going into year 2, they started realizing that the psychological, the stress factors that associated with management, treatment, and advocacy, awareness raising around COVID is so much that needed to be addressed. So strategies started, the world started re-strategizing to start focusing at addressing the stress that are related to COVID. And when they started doing that, there was massive improvement in recovery. There was massive improvement in positive responses towards control measures towards COVID. And I think that's when it hit the world and they realized that WHO has been talking about mental health, mental health, mental health. When we address mental health, you actually address a lot of the world's problems. So one of the main factors that gave a big blow and gave a big recognition for mental health is the COVID-19 pandemic that struck the world. But coming back to Uganda as a country, zeroing it down back to Uganda, Uganda also had so many strategies that they put in place. One of it was the lockdown.
Yeah.
The lockdown led to a lot of issues that by far you could even say the impact has been worse than the COVID itself. Gender-based violence increase, child abuses, early pregnancies. We are still dealing with it up to now.
Yes, yeah.
There are so many young teenagers, mothers. I saw news yesterday, a senior 4 candidate in Uganda gave birth.
Yeah.
Yes, during sitting as senior 4. Congratulations to her. But you can also attribute that to all that. And then after COVID, the news breakdown that came that 14 million Ugandans
Yes.
have mental illness. That gave a shock to everybody. Everybody became concerned. I remember every member of my family calling me, am I sick? Am I among the 14 million? Am I among the 14 million? So as a country, we had gone through a series of things. Uganda is one of the countries that has gone through a series of civil, is it called
Unrest.
civil? Yes, civil unrest. If you look, at least every region of this country has experienced it. And then the history of our taking of power has not been peaceful, has always been through at least either force or fight or something. So that had always created that state of anxiety, that state of uncertainty about tomorrow, has always given Ugandans the state of fear for their lives, fear for the peace and safety of tomorrow. But people had been quiet. Then still, when COVID struck them is when they realized every problem I'm going through is attached to mental health. Then by force, they started now. The government's hand got twisted to realize that, hey, mental health is important. The different partners, donors, started realizing mental health is important. Hence now the talk that you hear around stakeholders, you hear government is saying mental health. And then lastly, as I conclude, advocacy. Thanks to people like Janet and many other colleagues that we work with at the national level. From 2019, a few stakeholders and partners in this country took it upon themselves to ensure that there is intentional lobby, discussion, and advocacy around the mental health service delivery, access, and utilization in the country. So a team strategically came together, put up a working group that brought all the stakeholders that implement mental health in the country, and ensure that there is noise being made, there is discussion, there is caution of Ministry of Health, what is happening? Do we have a division at the Ministry of Health? Who is the person responsible? So with such awareness and such communication and talks around, we now have many people talking about mental health and uprising of so many advocates that is now to help people fight the issues for mental health. Thank you.
Yes, we have been joined by an officer from the Ministry of Health, and we would invite you to gladly introduce yourself.
Okay, hello viewers. My name is Patince Butesi, and I work with the Ministry of Health as a programs officer in the mental health and control of substances in the division at the Ministry of Health. Glad to be here.
Thank you for having honored our invitation.
Mm.
And so, going back to the topic of mental health, 35 Ugandans are mentally ill, and 15% of the Ugandans are required to get mental health treatment. I would want you to expound about the mechanisms of advocacy that have been laid out by the stakeholders, the different stakeholders in the communities, the civil society organizations, even the government itself, on how best we can create awareness on mental health. Because surprisingly, one time I was having a talk with colleagues and they were like, mental health is a myth. Yes.
Thank you so much, Helena, for that. If I can just roll back a little and say that according to I think the most recent systematic review we have, it places the figures of persons with mental health challenges in Uganda between 22 to 25. That is 22 for adults, 24 point something for 24 point something for children. And so we're looking at, okay, yes, averagely, maybe 30% Ugandans with mental health challenges. That includes some which are not really diagnosed as illness, okay? And also the rate of people seeking care is about 85%. 85% of the people that actually need care. And yes, there has been effort. I always want to start with the individual effort, that there have been very gallant Ugandans who have come out and are on this cause of mental health awareness or promotion of mental well-being. So it comes from the individual and then we get into collectives. So besides the individuals that are vocal, that are out there on their social media handles, in the spaces that they are in, talking about mental health and mental wellness, okay? Then there are those who are deliberate in creating good mental health spaces around them. You say they take the vibe with them because you know that the way you behave affects another person. So definitely there are those who are living the mental health agenda in their workplaces, in their homes, in their individual spaces, and we appreciate them. Okay? Then there have been collectives, as organizations, different organizations have come out and have put in place programs. So for example, there are those who are on TV and radio as a quarterly thing. They have plans to talk about this, to call upon the authorities, that the people that are in authority to make way for initiatives of mental health related nature. Is it control of substances? Is it alcohol policy? Is it treatment and access? Is it community-based? For example, my sister Gracia is from a civil society organization that is doing community-based interventions. I am from a private sector where we're providing and increasing access. My sister here, Patience, is from the ministry, who are our regulators and our promoters. Okay, so as individual organizations, there's also effort from those individual organizations to create awareness, to provide, to put in place systems to enable good mental health for Ugandans and improve the statistics that we have. Then as a collective, we have organizations where we belong. For example, the National Mental Health Working Group, that is steered from the Ministry of Health. Then we also have project-based groupings. For example, we are celebrating the National Mental Health Day for Uganda. There is a difference We had the World Mental Health Day on 10th October, but as Uganda, we'll bring it closer to home and celebrate, mark it as our national event. And we're having ours on 31st of this month. And so there's also a project vehicle that includes all these different stakeholders from the different organizations to do the advocacy, to do the planning, to do the funding, because they're also funding. The partners, the mental health partners are funding these activities. In schools, in all gatherings that we go into, there is effort from that. Is the effort sufficient to what we require? No. There could be more. Okay, there could be more that could be done by all these different partners, starting with the individual that I started with. As an individual, it is placed upon you to actually understand, then to educate, then to talk about. Because the people those statistics are our people. It is my mother, your father, your sister, your brother, your friend, your workmate. So it is the responsibility rests with you as an individual to actually get to know this thing, the myth that your friends talk about, this thing. And I keep telling people, because me, I'm in the treatment space, I keep telling people it's until it reaches your person that you actually understand, or it reaches you. Because we've seen giants fall, you know, because of this thing they call this, say, myth or white people problems, or rich people problems. My friend, it does not segregate across strata. Is it economic? Is it color? Is it social? Is it, you know, is it academic? Because the land, as equally as the unlearned, are all sufferers of this. So the better for us, all of us, to do that which we can in our individual capacities. Can the other stakeholders do more? The partners? Yes, we can do more. We can have more multi-sectoral engagements, more planned and well-executed initiatives and interventions, which can go together to know it can push a long way. Can the government, through the ministry, do better? Yes, we can do better. I keep saying that we want the same effort that was put in HIV/AIDS to be put in mental health. Because when you're looking at the statistics at the moment, yes, the figures for HIV/AIDS are high. But if you look at, actually, if we just take one component, suicidality right now, and look at how it is suffering and the effect, I mean, how it's affecting Ugandans, the figures, the age at which people, young boys, are starting to contemplate, die by suicide. And then you look at the ripple effect. A life lost, a young life lost to suicide is one that Uganda is not going to gain from productively. Okay, so yes, we can live positively with HIV. Yes, it also came as a pandemic and it swept, but ours is silently sweeping. If you look at the substances, alcohol and substance use, and look at the percentages of the youth who are in there, this should be deemed as bad or worse than the HIV. And the effort should be double what was put there then. Then it was not known, but now we know. So can the government do better? Yes. What can the government do better? Because there then we can start. What we want is a national agenda. A national agenda, if it is for creating of advocacy, let it be a national agenda for creating advocacy. If it is in improving access and care, can it be a national agenda? We will continuing to hear the story, man. It has been the only national referral hospital. Yes, there are efforts from private players. And which also, by the way, if we go into that if government actually tapped into the private players, there could also be improvement in access. So I'll just give an example. I keep saying that if government was deliberate about getting to know what is Safe Places doing, can we use them as a vehicle? Because the government is government, it is overall. It controls all things that are happening there. Can we use Safe Places to increase access of care to its citizens? They would find a way. Okay, can we use TPO as a civil society to increase access to our people, access of information and care and all these other things that we're talking about? There will be a way. Okay, so yes, there is efforts. Yes, the people are doing an amazing job. Can it be better? Yes. Thank you very much, Hellena.
By the way, I like what Janet has said. This year, the theme The global theme for the celebration of the World Mental Health Day that is commemorated every year on 10th of October was globally voted to be mental health is a universal human right. And now for Uganda, we have maintained that theme intentionally to cover at what Janet said. Addressing this, the responsibility starts with you, the individual, taking care of your own mental health, creating spaces for a good mental health people so that people can enjoy it, but most importantly, being also concerned and aware, knowing the people around you. Now, we have added and said mental health is a universal human right, and then we have placed the responsibility in our individual hands by concluding and saying, my mental health, my right. Now, for me, that hashtag is what makes a lot of sense. Mental health is a universal human right. That's okay. You know, it's a statement. Everybody can make it. But now if you bring it down to now the call for action and the hashtag that says, my mental health, my right. You are reminding yourself and asking yourself, as Grace, as Patient, as Hellena, what am I doing as a person to be able to ensure that my mental health, which is my right, is addressed? And if we are able to do that, you're going to realize that when you address your right, you're going to make sure you create a better space for Janet. Janet will create a better space for patients, and it will go around. Government and stakeholders can continue to create spaces that increases access, provide ease of utilization of the services, but individually, we need to be able to realize that my mental health is my right, and it starts with me. Then internally from me, it can scale out to the other persons.
True. Thank you so much. And my other question goes to the officer from the Ministry of Health. With the looming rise of the patients or the population that with the highest population of the Ugandans are facing mental health related issues, how is the government ready to address this? Yes, Janet has spoken about it, but we also want to hear from the government's side on how best it's going to do this, because for the private sector they can have that zeal, the civil societies they can have the zeal, even the individuals can have the zeal, but the government is seen to put the final stamp. And how ready are they? Actually, we were speaking and we're like, it's only Butabika, which is the only referral hospital for mental health related issues. And how best can the government create other referral hospitals? Because I do not think it's only people of Kampala having or suffering from mental health related issues. You can go on.
Oh, thank you, Hellena. And I'll begin by building on what Janet had said about mental health and what you said that most people think that mental health is a myth.
Yes.
I would want us to bring back ourselves. When we talk about mental illness, we think about the scaled out mental illness. We think of psychosis. We think of those people who are picking rubbish on the roads. But in actual sense, mental illness does not only mean that. It means more than just picking rubbish, looking dirty. Most of us are stressed.
Yeah.
And it goes on and we get into depression. We are anxious. There's anxiety, there's substance abuse. All those are part of mental illness. When someone is taking alcohol, and I am sure each one of us, somewhere, when you flash back, when you go back in your family, there is someone, somehow, who is affected.
Yes. Yeah.
So it is not a myth. We just pretend that it is not there, but the actual fact is there is mental illness, mental health problems all over the place. We need to be mindful, be focused on, when we talk about mental health problems, let's not focus on the bad, the extremes. Let's look at ourselves. Because when I'm stressed, when I'm depressed, my family suffers.
Yes.
And when that statistic of 14 million Ugandans have mental illness came out, well, it sounded ridiculous, but it's a reality. Once I have a mental health problem, my sister will be affected, my mother will be affected because they have to pay bills.
Yes.
My uncle will be distressed because they don't know the outcome.
Yeah.
So in the long run, all of us are affected in one way or another. And then when we look at the treatment, like we've said, this year the theme is my mental health, my right.
Oh, yes.
Even the mentally ill people have a right to access health.
Yes.
Healthcare is for everyone and it should be accessible and everywhere. So when someone has a mental illness, they need not to be discriminated. They should be attended to at a health facility closest to them. The Ministry of Health has tried. I cannot say that we have done 100%, but we have tried to train health workers of all cadres, not necessarily mental health professionals. When we go for training, we actually look out for other cadres other than mental health, be it nurses, be it clinical officers. We want to have a critical mass of people who can handle mental health problems. And it is not only Vitavika. Yes, it's the National Referral Hospital, but we have 13 regional referrals. And each of those regional referrals ideally should have a psychiatrist who is able to manage patients who are out of control. But generally, up to Health Center 4, there is a clinical officer who is a psychiatric clinical officer who is able to manage. Unless things are out of hand, that's when they should refer to the regional referral. But ideally, Health Center 4s should have a clinical officer. And more to that, as COVID has shown us, yes, all of us have a mental health problem.
Yeah.
So it is now government's role to go down to community mental health is what we are looking forward to. And we cannot do it alone.
Yes.
It is me, it is you. Do your part and the government will also come in and do their part. How will they do their part? It is through advocacy, education and all that. So that we nip the bud when it's still young. We manage the problem while it's still at community level. If I come and tell you, do not start drinking alcohol, because when you drink alcohol, it will affect you, you'll get addicted, you'll not be able to work. When I tell you at an early stage, before you get into the habit, then there will be no need for the National Referral Hospital to manage addiction, because we will have managed it at community level. And we cannot do it alone. This country is very big. The ministry in itself, as a department, I think we are about 7 people who cannot go the whole country doing up to community level. So how do we do it? At the ministry, we are lucky to have partners like this. We have TPOs, we have the Safe Places, we have many others, War Child, many NGOs whom we work with. And that is when she talked about the national working group. We come together as a working group and we agree TPO is going to do in which community. What child is going to do in which community? What are they doing? What interventions are they giving? We are aware of at least those we have in the working group. And when it comes to the private sector, we have a law. And in that law, we will come up with regulations. The regulations are not to stop you from working, but rather to work in a more streamlined way so that you have good services for the people. Because we know, I'm not saying Safe Places, there are people who have come up with the idea, they have no clinician, they have no space, but they want to start a rehabilitation center. So the role of government is to come in and streamline. Say, for you to have a rehabilitation center, you must have a clinician, You must have a psychologist, you must have a counselor, must have enough space, not in the middle of town where they will access drugs and such things. So really, I think the government is doing, may not be too big, but step by step we will get there. Okay. Thank you.
Maybe to also just complement or supplement what she has just said, government is doing, at least they got us a law in 2019, you know. Because before that, the story was different. Was it 1960? 60 what? Before
60,
that?
64.
64.
So at least we have an act. Yes.
You know, as a country.
I wanted to commend them.
And that act was only criminalizing mentally ill people.
Yeah.
Yes.
But now it is more on how they can access services, how best they can access the services.
Hellena, I think, like Janet said, we really applaud government for that. You know, as a country, for over 40 to 50 years, our mental health law had never been looked at or even revised. We were using, I don't know about which law of which year, but in 2019, Uganda officially got the Uganda Mental Health Act 2019. And that is great work by governments, great work by civil society and private partners that all work together to see that this law come out. And it's a beautiful law to talk about, to say that when you, those days before 2019, they would ask, so where is the Mental Health Act of Uganda? And you go and find photocopied pages that you are not even clear. 1964. And people ask you and you're like, really, what document are you even using for advocacy or for running these services? But we really appreciate from the side of civil society, and I know also the private sectors that are into this, appreciate the fact that in 2019 the Act came out. And the Act came out beautifully, protecting the rights of persons with mental illness, giving them rights to choose whether to get treatment or not, giving them rights for dignified treatment and management in a more dignified manner. It also rebukes a lot of these inhuman words that we use, like insane. You know, it all came out and scrapped confinement. It scrapped all that. It placed management of mental illness at a normal management of health issues. And one beautiful thing about the act that I like is that it placed management of mental health within the primary health care. Now, if you put services within the primary health care, you have literally given it back to the community. It starts even lower than health center 4. That if you walk in a health center within your village, at your village level, you should be able to ask a nurse and say, I need to speak to a counselor. That's how low the Mental Health Act has put the service provision of mental health in this country. However, and this is what, it's our work as civil society to always tell government, thank you, you've done well, but we would want this, okay? The however is that we have this beautiful act that clearly stipulates all this, but we don't have the regulatory mechanism. We don't have the laws that regulate that act. And you cannot implement an act without the regulations of the law. So our appeal to Ministry of Health is that we need the Uganda mental health policy. The Uganda mental health policy needs to come out. The Uganda mental health strategic plan, all those are regulations that support the implementation of the act. Okay? But also, most importantly, we need to see that the mainstreaming and the implementation of mental health within the primary health care is strengthened. We appreciate Ministry of Health of late. They have been doing a lot of training of cadres, like she said, from village health team, the community-based counselors on basic mental health understanding, and the general health care practitioners. But we can do better. Janet talked about a desk review research study that came out. That study said only 15% of Ugandans are able to access mental health services. There's 85 service gap. She said it, I want to re-echo this. 85 service gap patients, 85 service gap for Ugandans who need mental health access, mental health services. But we are saying that these services are supposed to be accessed within the primary health care.
Yes.
So can we ensure that the availability, because the trained personnel are there. Uganda has now, yes, I was very happy on Friday to hear
80.
we have about 80 psychiatrists in the country. We have moved from counting our fingers to 80.
And that is huge.
It's huge for our country. 80 psychiatrists. We have more than 400 psychiatric clinical officers. When you talk about psychiatric nurses, they're in thousands. Okay? And then we have more than 500 clinical psychologists that are who are graduated in this country. These are direct professionals in regards to mental health service delivery. Then we have psychologists, then counselors are so many. All these are personnels. So the personnels are there. We are asking, can we improve the mainstreaming of mental health into primary health care so that next year, the 85% service access gap turn into saying 85% of Ugandans are able to access mental health services when they need it. Safe spaces. This is also a cry, not only for ministry, from us civil society organizations that are doing community implementation, to you, the private actors that are into the structure of setting up this, that we turn the 80% lack of access to next year, 80% of Ugandans can be able to easily, freely, dignified access mental health services when they need it.
Maybe
But-
to ride on that, Grace, I wanted to say, yes, the personnel are there, but with a given population,
It is
still small.
Yes.
So can we utilize those who are there at least efficiently?
Yes.
Because when we talk about the utilization, that's when you look at the structure of government, where it doesn't make room for counselors and psychologists, and like in the public service
Structures, yes.
we do not have mandate. They don't have mandate to hire psychologists and counselors. Yet these are people who can be the first line, you know, of they can offer talk therapy and then de-escalate issues before they go up there. So yes, there has been an improvement, which is very, very big. For the longest time, we were on 31. Then people
80.
became 32. Then it became 54 with about 10 out of service. That gives that about 40. But now 80. That's
huge.
It's an achievement, and we are thankful for that. Yes, so I thought I would add that yes, even with the rising numbers, we are 40 million Ugandans. So even if you were to do your 80 and say what is the ratio of psychiatrist to patient?
patients.
Yes, ratio at the moment. But yes, nevertheless, we appreciate the small gains that we have got. Thank you.
But I think it boils back to us. Maybe the people are not accessing the services because they don't know that the services are there.
Available.
Yes.
They still think mental health problems are a myth. So
Stigma.
therefore, they will not go to the hospital. They will still want to first consult the witch doctors, then go to the pastor to pray for them. By the time they think about going to the hospital, it has escalated.
Yes.
And just to answer Grace and Janet, the new structure that is coming out, I think this next financial year, caters for all those cadres up to the lowest level. At least there will be a counsellor at the lowest level.
That's nice.
Maybe Health Center 3 will have a counsellor, which is, I think, in my view, a good thing.
It is.
It's very commendable, and we'll
It
come
is.
back here and we'll clap when
When
it happens.
And then, like I'm saying, we want to go back to the community.
Yes.
So maybe we shall engage more the community health workers than going to the hospital, because we don't want people to go to the hospital. We want them to manage their problems right at home and
Yes,
at
and
community level.
speaking about the treatment, for very many people have also stereotypes concerning that treatment. We have seen people that get that treatment and they get side effects of gaining weight from nowhere. And I think also it's a problem that is associated with mental health, that people get stereotyped about the treatment. They're like, I'm going to become obese. I'm going to do what? I want you to speak something about the treatment that it triggers my understanding, because I have a colleague who was tinier than I. But recently I met him and he was so huge. And when I tried to really like get to learn why has he gained this weight, he told me he had been at
been on
Butabika
treatment.
and treatment. Yes, something of,
Okay.
Maybe let me start.
yes, yes.
I want to start by saying that everything a human being consumes in this world has
Has
side
a side
effects,
effect.
positive or negative.
There is.
Last week on Thursday, I was with my mom in the hospital. The 82-year-old, they found that she had malaria 2+ and a bacterial infection. So in my normal last born worry, I asked the doctor, I said, so you're going to give her tablets to take for all this? Can we do IV or something? The doctor said, no. Tablets will be okay. As we were walking, I went back, I asked him, so what are the possible side effects of this, double treatment, malaria and infection? He looked at me and said, Grace, everything that we consume has side effects. And not that all necessarily you see it all. That's how I want to start, that every medication or everything that we consume as a human being has side effects. It's very true that the psychotropic drugs, those are the drugs that we use for treatment of mental illnesses. The psychotropic drugs have side effects. And the side effects starts from improving the status of the state of functioning in the person that has started taking it. You will agree with me that take a person who is severely depressed, month 1, month 2 into treatment, you find that their moods have been changed, the depression has disappeared. That is a side effect. However, as human beings, we will always look at Grace has gained weight, something has happened. Now, these psychotropic drugs, not all of them will lead you to having side effects. Majority of these psychotropic drugs are very human-friendly. And any treatment that you start, give it for cancer, HIV, TB, it comes with lifestyle changes. Now I'm speaking as a therapist.
Yes.
It comes with lifestyle changes. So what is normally warranted and is recommended is that when you start a treatment, the body responds to it. First by yes, it attacks the illness or the sickness, you start to recover. However, there are also other parts, the hormones and other response on the body that comes. And some of it comes with the growing big, okay? Now, it requires a lifestyle that fits that. If you're like Grace, who does not do a lot of physical fitness, does not do exercises, but you're on treatment, and the beauty with these psychotropic drugs, at least in my practice for the past 6-7 years, once the client is started on it, you're taken through the side effect. And that's what Safe Spaces does also. You're informed that these drugs come with a bit of weight gain. This drug has the side effect. There's some side effects that are worse than weight gain. They give you fits, they give you stiff neck for some time.
Yes.
So all the side effects are given to you. Now, the one specifically, the weight gain that people talk about a lot. Today I want to be a therapist.
Yeah.
Let's adjust the lifestyle.
Okay.
The reason why the weight gain comes, you might find that you have been depressed for months or years, and your appetite has been very poor. You have not been taking care of yourself.
Sure.
Now the drugs has worked. Your mood has changed, has improved. You start to eat normal meals. Okay? You start to live a healthy life. Then your body comes up. But some of the drugs also warrant, they give a lot of appetite. I was telling patients on Friday, when I was practicing from Nairobi, I started my practice from there. I told one of the senior psychiatrists that I want to consent to be taken through electroconvulsive therapy. It's called ECT. And the psychiatrist asked me, I said, are you okay? I told him, yes. I have seen it work massively in my patients with deep, severe depression, with severe state of psychosis, mostly for bipolar when they're in the manic. But then after I see the side effect, so I want to try it and see the side effect. Trust me, that is a story for another day. Okay?
Yes.
But it warranted me a bit of change after that. You know, changing in your lifestyle to fit in. So what I would recommend, maybe Janet will come. Janet is right now in the life practice. I've not practiced for 3 years now.
Okay.
Is that when you start this treatment, not only the psychotropic drugs, try to adjust your lifestyle according to the drugs.
Okay.
Because if it's giving you a lot of appetite, try to do regulatory eating, but also try to do a bit of physical exercises. Just walk around, you know, walk around, go to the gym. Patience and Janet have known me for quite some time. I had my baby last year in December. I have added twice the size I had. Not so.
Yeah.
All these
Not
are side
really.
effects. I've added some weight.
Yes, she has.
But not twice.
Not twice.
Not
Okay.
twice,
Okay. Let's say
yeah.
40%, 40 or 50. So this is side effect of a life event that occurs in us. Why I'm trying to ease it and make it seems like it's something that we go around it every day, because it's exactly what it is.
Yes.
It's when a new thing comes, there's always changes. So let's adjust our lifestyle
To
fit
adapt
into
to that
that.
change.
Yes, adapt to it.
But
Yes.
also, maybe to just add on to that and say that, you see, you weigh the benefits. Weigh
you
the
rather?
benefits. Would you rather be in that dark place? Or would you rather gain a little weight, which you can manage? So I always keep telling people, our area is so stigma infested.
Yes.
From the individual, there is self-stigma.
Yes.
From the people around you, there is
Community
stigma. Now, even stigma to treatment, stigma to medication taking. If we can break that, patients was talking about, let us start from the community. It's not only stigma. Stigma also comes from a place of ignorance,
Yes.
not being aware, and So if we can break those two, break the ignorance, break the stigma, then even the medication taking will be okay. I've had people saying, I don't want to go on the antidepressants. I'll become dependent on them. No, that's why you have a psychiatrist and a psychologist to guide you through that. You will not become dependent on the medication if you're doing it the right way. You will have reviews. You will have, you will have other supportive therapies. Because we're not saying that it is the magic bullet that will take away all that things. Then you will have other, psychotherapy, the support that comes after that. It is a two-pronged thing, So for me, if we can look at it in a way that even this weight gain is being lumped up together with all the issues that as mental health, which is a good thing, by the way, is having, then we can break it. So every other person that I interface with that says, I don't want to go on medication, I'm like, okay, so when you go for malaria, can you tell the doctor that I don't want to go on medication? It's as simple as that. Okay? When you go to a hospital, can you say that, you see this quinine, it makes me itch? Yes, it makes you itch. Then there will also be, there are those which will, okay, if you've got a stiff neck, they will give you something, or an unexpected side effect. The doctor will first of all inform you of the unexpected side effects, then tell you how to manage them. And also, if there is medication that can help you manage the side effects of that medicine, but we know it is the best medicine for you to take at that moment, it will be given to you. And then also, come to your doctor and say, I am feeling a certain way. If it is not out of the things that they were listed, come back for review. Because the doctor will say, okay, what are the circumstances surrounding you? You're prescribed according to your individual presentation. Okay? So that is it. Come back and seek help. Treat it. That's why you're saying it is my right. Just like any other health-related issue. It is you. Okay? So come back to the person, to the professional, and air out your concerns. Just because the other person gained weight. I've also seen those who have lost. Because this affects people differently.
Yes.
There are those who have become very small. So when you go on the general stereotype of you gain weight when you're on antidepressants and whatever, then we are losing it. Thank you.
Yes, and my other question goes to all of you amazing ladies. And I would want us to speak about the rising numbers of mental health related issues amongst women. I read a report that says 5.1% of the women have an increase in mental health related issues compared to the 3.6% of the male counterparts. What would be the reason, and what can we do to work around it? Thank you.
Thank you, Helena. I'll begin by completing what they were talking about.
Yes.
I think I'm loving the theme for this year about mental health. My mental health, my right. As a patient, you have a right. It's not gezi for you to go to your doctor and ask them, I'm going to take this medication. What are the side effects? What should I expect? And then again, it is my right as a patient not to be stigmatized. So it comes back to all of us. What is my role towards this patient? If they have gained weight, do not stigmatize them. You have put on so much weight. What are you up to? Already they are struggling with their own problems. Now you add more stigma. It is their right to live a life the way they want, because no one is attacking you. What is my role? What is your role? That should be the bottom line. Now, back to what you asked about the mental health among women. I think women bear the biggest burden of all the things. If we are to go back to our settings back home, for a woman, she's learned to know whether the children have gone to school, whether they are sick, how they will go to hospital, what kind of treatment. It is not unusual for a man to be at home and call the mother who is away, the child is sick, come and take them to hospital. Yet they are at home.
Yeah.
The mother is not a doctor, but they are calling the mother to come and take
Come and take
the
them to
child to hospital. Oh, what can I do? They are
The mother is a home doctor.
The mother is a home doctor, yes, and they're able to multitask. But again, in that process, they bear too much burden. And if they have no social structures to vent out to, they bottle up all these things. And in the long run, it escalates into mental health problems. And also, I don't want to believe so much that it's only women, because we know as Ugandans, let me not go far, let's stay here in Uganda. The health-seeking behaviors of men and women is very poor. A man will struggle with the problem and not go to hospital, but ladies will go and ask, I have a constant headache, what can I do? But the man will instead drink water, do what? Try to manage it from home. So I think, yes, the women may look like they have more problems, but in my view, I think it is their health-seeking behavior. That is why we get to know that they have mental health problems.
Thank you. I will just ride on to what Patience said. Yes, not disregarding the fact that women have a better health-seeking behavior, but also women have many more issues besides being the primary caregivers. I was just actually looking at the statistics of 2022, the offenders and whatever and you look at the domestic violence. Yes, it's just when you talked, I kind of, it clicked on me, and I'm looking at the cases for just domestic violence. That is 17,698. That it ranks number 3. Okay, if you look at sex offenses, 14,693, and who are mostly offended against?
The women.
Okay, just go there. If you go to child-related offenses, because what touches a child will
Touches the mother.
Okay, we look at child-related offenses, 13,489. If you just look at that, I haven't even gone into other issues of poverty. If we also to get the poverty, poverty ratios, because also poverty, we know that it is disproportionate for men and women, and also affects our mental health. So for me, what I'm saying, what we have as risk factors for women are higher. And so definitely our mental, actually we're even doing very well if we're only at 5.1%, because that means we are getting care on time, and then we're doing, maybe communities helping us do self-care in one way or another, because with this, it could definitely be higher than that. Okay? Higher than that. So if you look at this COVID period, what we've gone through, and the cases that came out, did you hear of men getting pregnant?
No.
At 7 years,
6.
at 6 and about whatever, you're getting it. So the risk factors are ripe and many for women. But that is not to make us victims or feel like we should give in to the statistics. We can rise and we can rise and do something about it. Over to you, Grace.
Thank you. Janet, thank you for putting out that record. It's what I was looking for in my phone. I saw it and I was like, wow. And then there was a news headline that came about a week or two ago saying that Ugandan population, 61% are women. And I looked at it, then I looked at that crime release that they released and I was like, okay, with all this, it is obviously, there's no way we can just say that the stakes are not so high, Women, there's a lot in regards to women that are prone to predispose them to mental health related issues, or even precipitate and perpetuate the mental health issues that they want to have, that's already there. For example, I want to give an example of childbirth. We have a mental health disorder called postpartum depression. Postpartum depression is a kind of depression that affects a mother immediately after delivery or during that lactating period. When you're lactating mother, there's that risk because of the changes in hormones in your body as you're pregnant, and then you've given birth, and then they're starting to get back. You're at a very high risk of developing or getting postpartum depression. And this is attached to childbirth. Like she said, men don't give birth. Their fathers, we respect them, but they don't give birth. I want to appreciate Janet. Janet supported me a lot. When I gave birth to my daughter last year in December is a period where everybody travels. People go away for celebrations and my birthday is 25th December, Christmas. And it's a time that you're used to. It's you people are celebrating. Then this time you give birth and it's everything is about the child. The people, the friends that you expect to be there, they have all traveled. They're all telling you, we'll come back in January and see you. To tell you the truth, I posted on a page where it had Janet and one of our colleagues called Liz. I posted and I said, even the new mother needs care, not just the child. And the two of them picked it up. And that was a cry for help. I was at the age of stepping into the postpartum depression state because I was feeling alone. I was feeling neglected. On my birthday, my husband woke up and carried his daughter and he was saying, hey, she looks better today. Until about 2-3 p.m., when the girls in the house came with a cake and a flower to say happy birthday, mommy, then he was like, hey, today is your birthday.
What day?
I've reported it. And my sisters and siblings that have always sent me happy birthday, Grace. On that day, Christmas, the message they were sending was,
Happy Christmas.
Merry Christmas. How is the baby coping? I actually caught feelings for two particular brothers of mine. They had never missed to send me happy birthday messages for the past 10-15 years. But this time it was, how is baby coping? And I was here in Kampala. I felt,
They are back in the village.
yes, everybody has traveled, gone to Gulu and I'm here in Kampala. So that kind of like put you, it's what I'm saying, it precipitates and perpetuates you getting into that state. And if these two amazing ladies had not come forward, I don't know what would have happened. Leaving alone that, the fact that women are given the responsibility to be able to answer, and we are supposed to answer to everybody, answer to the men. I'm going this, I'm doing this, this is what I'm doing, and then ensure the women, children are okay, and everybody in the home is okay. It's very rare for them to sit back and think and take care of themselves. for them to remember that, okay, I'm taking care of everybody. Who is taking care of me?
Exactly.
It becomes a very different, it's very difficult. And then lastly, workspaces. Workspaces, that's how you need to put a topic under the women speaking. Workspace related issues. It also precipitates a lot of mental health related issues upon the women. Thank you.
Yes, thank you so much for having honored our invitation and having given us very, very grateful insights on how mental health is our right and also how it is important for we as women to also ably speak up for ourselves and also to ably stand up for ourselves, not only that we are community caregivers, but also we are beings. And another thing is also recognizing the stakeholders that are the government, the private sector, and the civil society organizations and individuals on how we can fight and also promote mental health. Thank you so much, and we would like to give parting shots as we close the show. What would be your recommendations?
My parting shot is that let's not continue to think about mental health problems as a myth. Mental health is real, and there's no health without mental health. Let us look back and find our role in this whole situation. What is your role in case of mental health? Thank you.
And what is your responsibility in case of mental health? So thank you so much for hosting us, and please call us again. We would love to continue creating awareness about this. As a woman, I am honored to be in a space where I can promote good mental health. And my last word will be that let us be kind to one another. Let us bring the vibes to where we are. Let us love ourselves tirelessly, whatever the issue is, because ultimately, if it's in an empty cup,
You can't give what
you can't give what you don't have. Okay. And then lastly, let us join us as we celebrate our National Mental Health Day on 31st at Silver Springs, Bugolobi. Those are avenues of creating awareness, breaking stigma, getting your questions answered. Thank you again.
Okay. And the women speaking today, I want to speak to the ladies. It starts with you.
Yes.
If it's not yourself, then the rest can get it. So let us always rise up and ensure that we address our own mental health as women.
First.
Let us not allow the stereotype words that people keep saying. Women are emotional. You're expressing and they're saying, you're being emotional. You're saying things that you don't like. You're being emotional. It's okay. Be emotional. But always let us express and let us talk about it. And let us ensure that we are taking care of ourselves first. Because the world seems not to be there to take care of us. So let's take care of ourselves first. And let us hold the hands of fellow women and support them. And as we celebrate the World Mental Health Day, we commemorate on the 31st of this month. I would like to call upon now everybody. On 31st, like Janet said, at Silver Springs, starting at 7:30, come. We are going to be having Walk for Mental Health. We are walking. Minister of Health is giving us free t-shirts, free drinks and food. Come, let us
Come
go
at
to
least get
Silver
a
Spring.
t-shirt.
Let us walk and create the awareness about mental health. But most importantly, your mental health, you are right. Always remember that in everything that you do. Thank you.
Thank you so much. I've been your host, Sakisa Hellena, for today's Women's Show. And thank you, my panelists, for having shared your grateful insights. I have really learned a lot from the topic, mental health and rights of those persons with mental health related issues. And find our conversation on our Twitter handles, that is at Civic Space TV, and also YouTube, Civic Space TV.